Hi guys, it's Miss Medic here. Today I'm going to talk about erectile dysfunction. Erectile dysfunction is defined as the persistent inability to obtain and sustain an erection for sexual intercourse. Studies show that 90% of men with this problem are too embarrassed to seek help. The cause of erectile dysfunction can be divided into organic, which makes up 80%, and psychogenic. Some people with an organic cause of erectile dysfunction will develop a psychogenic component as anxiety hits in from the original organic cause. So how can we differ organic from psychogenic causes? Well, of course it is important to fully investigate the cause. However, there are some signs and symptoms which are more commonly seen in the different categories. For example, erectile dysfunction that is psychogenic in origin tends to affect men under the age of 60. In psychogenic erectile dysfunction, morning erections will still occur. These are often lost in organic dysfunction. Psychogenic origin will have a sudden onset and inconsistent response, with erectile dysfunction occurring on some occasions and not on others. Organic dysfunction, on the other hand, will have a more gradual onset and consistent failure. In terms of organic causes, a lot of them are rooted in cardiovascular problems. For example, greater than 35% of men with diabetes will have erectile dysfunction, and it can be the presenting symptom of diabetes. Cardiovascular disease, smoking, and alcohol usage can all contribute to organic erectile dysfunction. Psychogenic erectile dysfunction is related to anxiety. Some drugs are associated with erectile dysfunction. It is important to check if your patient is on any of these medications. These include beta blockers and SSRIs, amongst others. So how do you investigate erectile dysfunction? Well, patients should have their 10-year cardiovascular risk assessed. They should have bloods done to include fasting glucose and lipids, and they should have free testosterone done in the morning. If the testosterone is abnormal, they should have FSH, luteinizing hormone, and prolactin checked. The patient should be referred to endocrinology if abnormalities in these occur. A patient may also be referred to urology if they have never had an erection. Erectile dysfunction is often treated by phosphodiesterase type 5 inhibitors. These work by increasing the level of nitric oxide in the body. This will cause vasodilation. Phosphodiesterase type 5 inhibitors should not be prescribed in patients who are on any medication that increases nitric oxide, such as nitrates or nicorandil. It is important to remind the patient that this drug will not produce an erection without sexual stimulation. These drugs should be taken an hour before sex. This concludes my presentation on erectile dysfunction. If you enjoyed it, please don't forget to hit the like button and subscribe to this channel for more medical videos.